Hi, welcome back. This is the next slide. If you are just tuning in now, you should go back and listen to the recording of the first 18 slides before you do this one. So we're talking about the precede model, and we're in the environmental factors box, and we're talking about community level environment and what kind of things are included there. So you can see here a list of things: availability of work and income, quality and quantity of housing, access to health care, and so on. I won't read through all these, but you can see that these are all things that exist at the community level that can influence health from an environmental perspective. And again, we're talking about environment both as the physical environment as well as the social environment. Then if we move to the societal level, here's another list of things that apply at the societal level. We have things like legislation, enforcement of laws, regulations, and so on. So these are all things that you should be thinking about as you do your precede assessment. Now we're at personal determinants. There are those boxes in phase 4 of precede that affect both behavioral factors and environmental. This slide is called Describing the Individuals Who Are Potential Program Recipients. Sometimes, I think we sort of, in community and behavioral health, we often are thinking about the person that's at risk as the person who would receive a program. So if I smoke, you want to try to get me to quit smoking. But sometimes the people at risk are not the people that are going to be the recipients of the program. Examples of that would be if we're trying to change the eating habits of children, we might very well ignore attempting to intervene on the child themselves, but rather their parents or the cafeteria at school or some other group that influences that child's eating behavior. It might even be what's sold at the market or the grocery store rather than the parent or the cafeteria workers. It might be even at a larger level of what food is available to a particular community. So that's just what this slide is saying, is that the participants in your program might not be the at-risk people. They could be the people in the environment who create the environment. And I gave you an example a couple sessions ago, the popcorn example, movie theater popcorn, and how the actual recipients of the media campaign, the intended recipients, were not the general public, although there was probably a positive benefit on the general public, but the intended recipients were something like 8 movie executives who had control over the popcorn, the oil that was used in cooking the popcorn in movie theaters. So personal determinants are, again, these things at the personal level that influence people to behave the way they do. There's a point made on this slide that the evidence for determinants is usually correlational rather than causal. So that means that the determinants are somewhat hypothetical. What's meant by that is that there may be research saying that my perceptions of susceptibility to lung cancer will influence or are related to my use of tobacco. So it's when, depending on how the data are collected, it may be correlational, which is usually because that information is collected at the same point in time rather than causal. So we don't know that if you change my perceptions of susceptibility that it will actually change my behavior. We just know that those two things are related, and that's what that second bullet is trying to say. I'm going to skip the rest of the content on this slide because I think we've already stated. Okay, this slide is about how the precede model as used in intervention mapping is a little different than the precede model as originally developed by the original authors, Green and Kruder, and different than how it is presented in earlier versions of intervention mapping. In in these previous versions, it used the terms enabling and reinforcing factors. And those are things, enabling factors are things that help you to do something. So having health insurance enables me to get health care. So health insurance could be thought of as an enabling factor. Reinforcing factors are things that that give you rewards or punishments for behaving in a certain way. So if I am 14 years old and I smoke cigarettes, there's going to be some positive reinforcements probably from some people in my environment, like peers who also smoke. But then there may also be some negative factors or negative reinforcement from other people in my environment, like my parents may punish me if they catch me smoking. So that's what reinforcing factors are. Those two terms are not used in the current version of intervention mapping. I'll just leave it at that. It's only really of interest if you're looking at the history of intervention mapping, or you're going to go read the textbook for precede and find that it's different. So where to start the needs assessment? I don't have the program plan right at my fingertips here, but I believe it is question number 3 asks you where you're starting your precede model. So the most pure way to do precede is to start with quality of life and say, what are the main quality of life concerns for a particular population or community? More often we start with a health problem. So we might start with something like lung cancer or asthma. That's often determined by whoever's funding us to do this endeavor. So we often start with the health problem, and many of you have sent me ideas that start with the health problem. I think a couple of you have started with quality of life. And then you could also start with a particular behavioral factor or an environmental factor. So if you're starting with tobacco use as a risk behavior, then you're starting with a behavior. If you're starting with lack of access to health care, that's an environmental condition. So this part of your program plan asks you to specify where you're starting the precede model. Now, at the face of that, that might sound like a pretty simple question to answer, but in some cases it gets a little hazy where you're starting, and you may need to talk with me about where you're starting, and sometimes we have to play around a little with that. So an example for that would be unwanted pregnancy. Is that a quality of life concern? Is it a health problem? Well, there are behaviors related to unwanted pregnancies, right? So if you're not using effective contraception, or if you're, well, let's start with first if you're having sex, and if you're having sex and not using effective contraception, those are behaviors that lead to unwanted pregnancies. But is an unwanted pregnancy a health problem, or is it a quality of life problem? So that's where it gets a little hazy. I'm not going to try to answer that question right now, because then I'd probably change my mind later. But I would say an argument could be made for putting that either in the quality of life box or the health problem box. Actually, right this moment, it seems like unwanted pregnancy is a health problem that leads to quality of life issues. So if you have an unwanted pregnancy and you're going to carry out that pregnancy, there are certain ways that that's going to affect your quality of life. Maybe you won't finish school. Maybe you won't be as employable. You won't be able to be employed because you have childcare needs. So if you think about unwanted pregnancy as a health problem, you can then specify what are the quality of life concerns associated with that. Now, for this project, it's not acceptable to start with a particular intervention idea. So I think I've said that about 1,000,000 times now. But if you were thinking, oh, I want to do a school-based program to prevent obesity, and it's going to be classroom activities showing kids how to cook, that's not where you can start right now. Maybe in the real world you can go out and do that, but For the purposes of this assignment, I want you to start with either quality of life, a health problem, a risk behavior, or an environmental condition. You also can't start with a personal determinant. So you can't say, well, people don't understand that fracking is dangerous, so I want to address the lack of knowledge about fracking. You would need, if you're interested in fracking, you need to start probably in the environmental box and then do the assessment of how fracking influences health and how it influences behavior, and start the model over there, and then it'll trickle back to personal determinants, and maybe knowledge about fracking is not where you would go with that. So I hope that's clear about picking a place to start, and feel free to bring up questions about what you've submitted for your topic and how that fits into these three different places that you might start your needs assessment. I guess it's 4 different places if you count behavior and environment separately. So no matter where you start, whether you start as quality of life, health behavior, health problem, health behavior, or environmental factor, you still have to cover all the model's phases. So if you start with a behavior, you need to link that behavior to health problems and to quality of life problems. If you start with quality of life, you need to link it back to health problems and behavioral and environmental problems. So precede model says you got to go both ways. Regardless of where you start in that model, you need to fill out the whole model so you're fully aware of what's important in what you're doing. So how do you describe health problems? Here is a list of things to consider as you're describing your health problems. I believe this is number 4 in your program plan. Here's some questions you can ask. And here is number 4 and number 5, and I won't read these out loud, but this is what you need to cover. It's the same as what's in your program plan with the recommended lengths. And the next slides just talk about describing a population at risk. So population at risk is some sort of group with a definable boundary and shared characteristics. This slide shows you a picture of minors that have certain risks associated with the fact that they are all minors. So the target or priority population could be defined by a shared risk factor or a health problem. So it could be people who smoke, or it could be people who have lung cancer. Sorry, I keep using tobacco. It's such a, I don't know, it's easy for me to think about. It's so clear. Other problems are not quite so clear. So there's different ways that communities can come together. We talked a little bit about community on Thursday. I think I'm going to see this slide. This slide talks about rates and how rates are calculated, incidence, prevalence. I think I'm not going to go into detail on this. The book does go into detail on this if you're having trouble remembering back from your EPI class what's incidence and prevalence. Those are really important concepts. So I would say look into that a little. Here is a list of primary data sources. So primary data sources mean you collect the data. Secondary data sources are sources that are already out there and you go to them to get information. But primary data you would collect yourselves. And in this class you won't actually be collecting data yourself. But here is a list of various different ways to collect primary data. So when you're doing your core processes, if you think back to the beginning of this presentation, one of those things in the core processes is to determine where new data is needed. And so you might decide, oh, well, we need to do some focus groups so we understand this problem better, or so we understand what are the quality of life concerns for our community. That would be an example of collecting primary data. This slide, and I believe these links are all active, although I did not test them. this time around. I tested them last year. These take you to various different places where you might find data about your health problem. Same with this slide, different sources of data for your health. And again, this one. These slides actually came from the authors of the book, and so they tend to have a lot of Texas examples because some of the, in the Netherlands, some of the authors are from Texas and one is from the Netherlands. So this slide shows you the Kaiser Family Foundation website. And, yes, okay, I was just making sure that that link doesn't say Kaiser Family Foundation, but it is going to the Kaiser Family Foundation. So the Kaiser Family Foundation is not related to Kaiser Permanente. It is a foundation that collects a lot of very interesting health data. So you may want to go to their site and look and see what they have about your particular problem. Their information tends to be about access to health care and healthcare coverage. This is the Colorado Department of Public Health and Environment website. And this particular slide is from a few years ago, so I don't know if they have exactly the same layout as what you're seeing on this slide, but they do have a wealth of information. So if you're proposing a program in the state of Colorado, you can find out things like, you can get information down to the county level about things like teen pregnancy rates and tobacco use, I believe, and lots of cancer rates, lots of different things that go down to the county. And here are links to CDPHE, Colorado State Health Department data. These are fresh links. I did check these a few days ago, and you can use those to get access to some of those pages. And I am again going to stop this recording because if they get too long, they're too hard to upload, and I guess we're going to have part 3 of this. So tune back in for part 3.